and welcome to my channel. My name is Jazzy RN. I have been a utilization review nurse working remotely for over 9 years, and I have experience working with 3 different companies, and the goal of my channel is to help nurses pivot from the bedside to remote work. So first we're going to start off with this company called UBC. They're looking for a registered nurse in a call center, and it says weekends only, but then it also says remote and full-time. Now I want to point out this one thing where it says it was posted 4 hours ago and 74 people clicked apply. I want to show you something else, and the reason why I'm actually showing you this is because I want to state that it's actually always better to set up job alerts to the company's website or join the community. That way you get the job notification as soon as it actually posts on the company website. So I'm going to go to UBC's company website. Let me just actually go backwards on here to the main screen. So as I'm going backwards, I'm going to show you the list of jobs that are available with UBC. So you scroll down here and there are 10 of 31 jobs. Now, as you look, I'm going to show you exactly what I found regarding UBC and this nurse job. And this nurse position has actually been here on this website for 18 days, but it did not hit LinkedIn until 4 hours ago, which is why I want to stress the importance of signing up for either the job alerts or here UBC has a join our talent community link. This allows you to get emails directly to your notifications directly to your email address of new jobs that are posted on the website. So LinkedIn is a great resource, but the company website is the source. So this job was posted 4 hours ago, but it was actually posted 18 days ago on the UBC's website. So we're going to go over the job. The first thing I always do whenever I'm looking at jobs is look at the qualifications first. And the qualifications for this job is at minimum an associate's degree and professional nurse license. They want you to have your nurse license in good standing in the state in which you work and are cross-licensed in other states. They also want you to have a compact state license in eligible states. Additionally, you must be willing to obtain a compact state license at such time as your state elects to adopt the compact legislation. So let's say, for example, in Illinois, as of February 2026, it is not a compact state, but once it does become a compact state, they want you to update your license from single state to compact state. They also want you to have a California state license, and the employee must be willing to obtain additional single state licenses upon request. I'm assuming most likely most companies will actually pay for the additional licenses. They want you to have 2 to 5 years experience. They don't mention if they want you to have experience at the bedside or telephonic nursing experience, but I'm guessing it's most likely it is bedside experience. They want you to have basic database and office navigation skills, which you already have, working in the bedside, working on Epic, Cerner, Protouch, etc. You have basic office navigation skills and the ability to maintain a high level of customer interaction, service skills while talking with patients, prescribers, and our specialty pharmacies via phone, so on and so forth. Now, if you are so lucky to get an interview with this company, you want to look at the job duties or tasks or responsibilities to figure out exactly what questions you would ask during the interview process. So I'm not going to go over this job. It's plenty of self-explanatory answers. So participates in program-specific customer meetings and training sessions. And this is all based on a call center job. So if you've ever worked in a call center, which I have, it's a lot of incoming calls, sometimes outgoing calls, and so on and so forth. I do want to also mention I have a free list of over 70 companies that hire nurses to work remotely. Now this list is in the description box below, and once you click on it, you'll have access to all of these companies. Most of these companies hire nurses for the United States, and some of these companies actually hire nurses in the Philippines to work for American companies. I believe I have some companies that hire nurses for Australia and Canada on this list as well. I also want to point out, if you will scroll down towards the bottom, you'll see a link to my course on Udemy, and the course is called Remote Nursing: The Cure to Bedside Burnout. And then you'll see a list of office essentials that will help you with your remote nurse journey. And at the very bottom, you'll see a FAQs with a list of questions and answers regarding working remotely. This next company is with Care Harmony, and they have multiple positions available for LPNs. As you scroll down, you'll see where it says remote work. Work from the comfort of your own home in cozy clothes without a commute. Score. Love it. Now these jobs here are remote bilingual Spanish plus English LPNs. Now they do have a position here which is a remote care coordinator LPN, and we'll look at this one. Now, as always, the first thing I look at is the qualifications. Also, just an FYI, you can share this job with someone if you wanted to. So the qualifications for this job is an active compact multi-state license. They want you to have Microsoft Office Suite experience, and make sure on your resume you do type Microsoft Office Suite word for word. Don't use Microsoft 365. You want to make sure that the ATS system, applicant tracking system, picks up Microsoft Office Suite. They want you to have excellent written and verbal communication skills. A plus is Epic experience. If you don't have Epic experience, let's say on the job working as a bedside nurse, most likely you will have Epic experience if you, during the nursing school process. During nursing school, you learn so many different EMRs or EHRs, which is electronic medical records or health records. So I would include that if it is an option for you, if it's not too far back in your history to add your experience in Epic in nursing school. A plus is also being bilingual, and if you have any additional single state licenses, you must have active high-speed Wi-Fi, and they do want you to have a home office or HIPAA-compliant workspace, and that just basically means your office is a room with a door that locks. And just an FYI, the 3 companies I've worked for, no one's ever come to my home to make sure my workspace is HIPAA-compliant. And also, during some meetings, sometimes they'll have us on the screen, and the supervisors or someone in management, sometimes you'll see their kid or their spouse walking through the frame during a meeting. So, I mean, HIPAA compliant is basically just don't have someone in your face while you're working, watching you what you're doing, because most of the times you'll have the patient information in your screen. Sometimes the hospitals will send clinicals with the patient's social security number on the clinicals and the patient's name, date of birth, address, everything. So just make sure no one's around you watching you do your work. So back up to the requirements and tasks of the job. So this one says you manage patient census with a resolution-driven approach to close gaps in clinical and non-clinical patient care. I would ask, what type of gaps are you closing? Because you're on the phone, so what exactly you're doing? What gaps are you closing? And also research Care Harmony itself to see exactly what this company does. And this is whenever you're in the interview process. Use the requirements or tasks or responsibilities as basically an outline of what kind of questions you should ask during the interview process. You want to identify and coordinate community resources with patients that would benefit their care, provide patient education and health literacy on the management of chronic conditions. And I would ask during the interview process, are the employees given a list of literacy to provide to the patient regarding their chronic conditions for diabetes, heart failure, COPD, hypertension, etc. Perform medication management, identify potential medication concerns, reconciliation, adherence, and coordination refills. The question I would ask during the interview process would be, is there a software that lets us know that the member or patient is in need of a refill soon? Are we letting the patient or member know your refill is due, let's say in a week or a month? How is that? Is there a software that actually help us with notifying the member or patient? Assist in ensuring timely delivery of services to your patients. Home health, DME. DME means durable medical equipment. That could be either, let's say, a wheelchair, a hospital bed. Let's say some patients or members go home and they need a hospital bed because they have multiple pressure ulcers. DME can also be let's say not only a wheelchair or a bed, it could be a walker. Home infusion and other critical needs. Resolve patient questions and create an open dialogue to understand needs. That's something you do already at the bedside, and then assist, manage referrals, and appointment scheduling. And I would ask about appointment scheduling. Are you actually giving some kind of list of when these appointments arise to remind the patient or member of these appointments? Is there a software available that actually helps you help the members? Questions like that. This next company is called Wellbox Health, and this is for a remote LPN care coordinator. This was posted 22 hours ago, and only 2 people clicked apply. Now, as always, the first thing I look at is the requirements of the job. So they want you to be an LPN that's licensed, is clear and active. They want you to be licensed in the state of your residence. A compact license is required if available, which is nice because for the state of Illinois is not a compact license state. So let's say in the future when Illinois does become a compact state, they want you to upgrade your license from a single state to compact state. Must reside and work in the continental U.S. Must have a minimum of 2 years of clinical experience at the bedside, experience in care coordination or care management, health coaching, and motivational interviewing a plus. I would try to add a little bit of health coaching and motivational interviewing to your resume, because whenever you're dealing with patients at the bedside, you are coaching them to take their medications correctly and be compliant with the care that they actually need, to take their medications, to, let's say, do their dressing changes either once a day or twice a day. So you're actually being a coach and a motivational nurse at the same time when you're a bedside nurse. Hands-on experience and comfort with electronic medical records, that is Epic, Cerner, Protouch, Meditech, etc. Experience using Microsoft Office products such as Teams, Outlook, and Excel. Now, Teams is basically an instant messaging. It's company-wide to send instant messages via Teams. Outlook is the email, and then Excel, whenever you are using Excel, you're not doing a lot of advanced Excel work. So basically in Excel, for one company I worked at, because they didn't have a productivity tool in the software they had, the program, because it was brand new, they had us enter the time we started a authorization on the Excel sheet and the time we ended that authorization on the Excel sheet. And some of the other companies will have you, let's say, filter out Excel sheets looking for information. But other than that, you're not doing anything in an expert level, I should say, on Excel. So up towards the functions or responsibilities of the job. So here we are. Manage and support patients' healthcare needs via phone and digital conversations. The questions I would ask about this job if I were to get an interview is, are these phone calls incoming and outgoing phone calls? Digital conversations, are we sending some sort of internal electronic messages to the members or customers or patients to converse with them digitally? Conduct telephonic patient encounters and document care plans and care plan updates, leveraging technology platforms and EHRs. And EHRs is just electronic health records. For this statement or bullet point, I would state, are there a list of care plans that we would use that we can just copy and paste to update the patient encounters? How does that work? This next one is assign and contribute to care plans that address patients' physical, mental, and preventative health needs. So are we using, for this statement, are we using our own nursing judgment to address the patient physical, mental, and preventive health needs? Or is there a pre-assigned, pre-approved care plan that we actually just implement with the patient? Virtually coach patients to reach their care goals by following medical treatment plans that include healthy eating, physical activity, stress reduction, etc. This is something you already do at the bedside. You're trying to coach this patient to take the medication, to take it like they're supposed to be compliant, etc. Coordinate some administrative aspects of medical record recovery, appointment management, and insurance claims. I would state for this statement is, during the interview process, Are we actually contacting the insurance companies regarding the claims? Regarding medical record recovery, what is needing to be recovered? Is something being lost? Is there some kind of system malfunction? And appointment management. Are we actually assisting the member or patient with their appointments? Are we actually following up with the patients regarding the appointments, how the appointment went? Are we actually going to be involved with the times and dates of the appointments? And this last bullet point, proactively suggest services or preventive screenings relevant to each patient. Now this seems like it's giving a little bit out of the scope of my nursing license. What am I suggesting? Which services am I suggesting? Are these services suggested? Are they coming down from a doctor, or is there a list of services in which I can include to give to the patient or member regarding what's relevant to them? That's some questions I would ask during the interview process.